Ricky Matthews Show. I enjoyed that conversation with Hunter Dawkins. And now we move on to the feature each week, second half of every Wednesday show that I really enjoy doing. It's terrific. Singing River Health Talk, and it's powered by Singing River Health Systems. And as I've said many times, they're the real deal in this community. They've got their not only their pulse on literally the pulse of coastal Mississippi through their health system, but they're also incredibly involved in the community in so many different ways. And I've enjoyed focusing on Singing River over the 5 years that I've been doing this show. And now we get this weekly dose of excellent health advice backed by the best. And today I've had the opportunity to visit with Heather Sudduth a little bit during the break, but I want to welcome Heather Sudduth to the show. She's a coordinator for Neuroscience Programs at Singing River Health Systems. We're going to learn a lot more about what that's all about, but we're going to really highlight stroke awareness, something that's near and dear to me, given that my mother had stroke at one point in her life. Anyway, we'll come back to all that at some point. Heather, how are you doing?
I'm doing great. Thank you for having me.
It's good to see you. So I always like to ask people, where are you sitting right now?
I am actually sitting in one of my offices in Pascagoula. I am located in the Healthplex building, which most people know about it. It's the medical park in Pascagoula. So on the east side of town.
Heather, you're the coordinator of Neuroscience Programs, and we're going to what I'll do is get you to kind of frame it. We'll come back into some details about that in just a second, but I'll get you to frame it. And the fact that about 18 or so years you've been involved in this sector, you've had a big influence in the program that's been developed there. Give us a sense of what you do.
A coordinator for a stroke program, what we do is we maintain all of the standards of the rules and regulations in order to have a program. So most stroke programs are certified by a body, either the Joint Commission or DNV. And there's just a lot of rules and regulations that you have to do, and just trying to keep the staff on track of, what they need to do to give the best possible outcome to our patients. And that's really where it goes down to, is that, even though a lot of my work is data analysis, when you're analyzing the data, what you're doing is you're looking to see where our areas of opportunity are, or where we're doing a great job and continue with those great things, or try to kind of improve on where we may have some areas of opportunity. So a lot of my work is analyzing the program and making the program the best that it can be, so that we give the best patient care that we can to patients that come to any of our hospitals. We have three. We have Pascagoula, Ocean Springs, and Gulfport. Two of the three hospitals, both of them in Jackson County, are what we call a primary stroke center. And then our Gulfport campus is accredited or approved through the State Department of Health. So it's a little bit different than our other two campuses that are actually certified through DNV.
So, yes, UAB, I went to paramedic school at UAB, as you know, and it's a terrific learning institution up there, great medical center. One of my best friends was in the hospital administrator program. And you went to the occupational therapy program out there. It's a great experience for you, wasn't it?
It was. I actually had moved to Birmingham my junior year in high school, and then stayed there and did college at the University of Alabama, and then moved over to UAB to do my degree in occupational therapy. And just a great area, city for opportunities for, the medical field. But I wanted to come back to the Gulf Coast, where I was born and pretty much raised until my junior year in high school. And so moved back down here and started my career at that point.
Well, that's cool. And then you went on. Yes, interesting. As I studied, you became a certified case manager, and you did ergonomic assessment specialist, et cetera. But it kind of set up your career for what you're doing now, didn't it?
Absolutely. And that's one of the things I go around and I speak to a lot of high school kids, and, tell them just to, get a good foundation with your degree. And, it can be a springboard to so many different things. So I practiced occupational therapy exclusively for, I guess, about 5 years. And then I got certified as a case manager. At the time, I was the only occupational therapist in the state of Mississippi that was certified as a case manager. That's typically, a nurse will get that additional certification. And then from that, I started, working in the stroke world a little bit with a colleague, and we created the first stroke program in the state of Mississippi back in 2007, and then just continued in that realm until this day.
Wow, that's so interesting. So tell me more about what you guys do in your neuroscience programs.
Neuroscience as a whole, what we're trying to do is look at whatever the neurological diagnosis is that, a patient or a consumer in our community has, and try to give them the best medical care that we can, providing them, the expertise from our physicians, our advanced practice providers, the nursing staff, and then in addition to the care, making sure that we have a lot of good education for the patient within the clinics or the hospital, but also, when they're in the community. I look at anybody in the community as somebody that can benefit for education. We live in the South. We have a lot of risk factors in this area. Most of the people have high blood pressure, cholesterol issues, diabetes, all the huge risk factors that go along with stroke, especially. We are just the breeding ground for it in our area. And so, I think, neuro as a whole, we really do try to provide the good care from the providers, but also trying to educate everybody.
Yeah, I've had it's interesting. It's been a constant theme throughout just about every single conversation here on Singing River Health Talk over the last few weeks that, the risk factors are pretty significant in the South. I mean, look, I think the first thing people have to understand and realize that 51% of Mississippians live in rural areas. And so oftentimes what that means is they don't have necessarily access to healthy food. And a lot of it's cultural. A lot of fried food and a lot of fattening food. They're not really focused on the kind of, what we're learning. I mean, and as you well know, Heather, what we're learning about diet and the relationship between protein and carbs and fat, we're learning so much more about that. It's not part of our cultural awareness to know these things. We don't understand what caloric intake is. And as a result of that, over time, people get to pre-diabetes and then to diabetes. And again, your point about cholesterol and then, of course, high blood pressure. All of these are terrible warning signs for potential stroke scenarios in the future. And it's unfortunate. Some of this is manageable through proactive care, but it is unfortunate you have to deal with people who culturally are put into a position where stroke is an unfortunate outcome.
Yeah, that's correct. So, you start with just your basic risk factors that they're called non-modifiable risk factors that we don't have any control over. So men, African Americans, and people over 55 already have risk factors that they can't do anything about. And then you put them in the South, so we're in what they call the stroke belt. And so you have this higher population of people, they're going to have higher risk factors. And then you add in, like you said, you add in the low socioeconomic area. You have rural areas where people don't have really good access to some things. And then you just and then lack of education, just in general. So I think some of the good stuff is, I believe it's the Let's Go Gulf Coast initiative with the children, even just starting there by getting these kids to eat healthy at a younger age, and moving that through the lifespan. I think that's where we really have to start is, very young, but also continue that education. So when we have a stroke survivor in our hospital, I like to promote education for everybody that's in the room. So you have just the basic risk factors that the patient has, but I like to go over all the risk factors, especially if there's somebody else in the room, because there might be somebody else in there that has diabetes, even though that the patient didn't have diabetes, or blood pressure issues or cholesterol issues, or they may be a smoker, or they may be obese. They may have these other risk factors that the patient doesn't have. But what better time than to educate our community than when they're looking at a loved one that just had a significant change in their health? Stroke is sudden onset. You don't get any warning about having a stroke. It's just boom. And then all of a sudden you have your deficits. So, it's a pretty big eye opener for people and their family members. So be able to provide that education in real time when people are like hyper aware is a great opportunity to try to educate our community. And right now, well, probably over the last, I would say 5 to maybe even 10 years, I've been noticing a trend where the people that are having strokes are younger. And so we're seeing people in their 30s and 40s, and probably my average age now is probably mid to upper 50s of who's having a stroke. It used to be an old person's disease is what everybody thought. Somebody in their 80s, you would see, late 70s to mid 80s was kind of your main age range. And there was this big shift where it was just younger and younger. And so we start going, okay, is it drug use? Is it this? Is it that? And it's not. It is just this really unhealthy lifestyle where first world, we want everything right now and, fast food. And it's just really taking us down.
When we come back on the other side, we'll continue our conversation with Heather Sudduth for Singing River Health Talk. We'll see you after this. Welcome back to Singing River Health Talk. We're visiting with Heather Sudduth today. Heather, actually 18 years of experience in the stroke program development, mentorship, and she created the first joint commission primary stroke center in Mississippi. So you can tell from talking to her that she's extremely passionate about what she's doing. It's so alarming to hear you talk about the age of those who are having strokes continue to go down as a result of what we know is kind of unhealthy eat habits, unhealthy lifestyles. I think we're having some important conversations in the nation today about the importance of whole foods and weighing that against processed foods and what we have access to these days. I bet it gives you a really, really, satisfaction to see someone who's had a stroke who comes through it on the other side, or maybe family members that have been positively impacted by the kind of programs that you have teaching them how to avoid being in the same situation as their loved one. You probably see many cases like that where you've seen just really good outcomes.
Yeah, you really do. You see both. Unfortunately, you have the completely opposite end of the spectrum where, you have a major part of your brain that's affected. And unfortunately, they will have lasting deficits, very severe deficits. But so we have a drug, they're called thrombolytics that we have. There's alteplase and tenecteplase, the two that are out there that are utilized, that if a patient gets to the hospital within 4.5 hours of the last time they were known without any symptoms, and they can get to the emergency department, and if they don't have any exclusions, we can give them this medication, it can dissolve the clot and let the blood and oxygen flow back through the vessel to the brain, which tries to get that brain the best chance that it can to restore itself back to as close to normal as possible. And so being able to do that really has changed the lives of so many people. I believe it was like around 1996 when alteplase came out, which was the first thrombolytic for stroke. And so, it's really been a game changer. And within the last, 2 to 3 years, this new drug, tenecteplase, has come out. I would say like a relative. It belongs to the same drug company and everything, but it's made care and given to the patients even quicker, and just same really good outcomes. And to be able to see somebody come in and their whole left side of their body is not functioning at all, and then they walk out with, just very minimal deficits, just amazing. As you said, you had some connection to stroke. My grandmother actually had a stroke before I was even born. So all I knew is a grandmother who was bedbound, couldn't move. I believe it was her right side of her body. She couldn't speak, just very devastating. But that's all I knew her as. And then, full circle to just a couple of months ago, a friend of mine's sister had a stroke in her mid 40s, and just being able to see the care that she got and the difference, and being able to pretty much be back to taking care of her family, doing different things. Still has some deficits to work on, but it's just such a difference from 50 years ago to now.
It is. That kind of describes my mother. She was completely dead on one side of her body. And through a lot of hard work, she was able to get back. She was driving and walking, and her personality changed slightly. But it's funny, my mom was a tough woman before she had a stroke, and she was the sweetest thing ever till the day she died just a couple of years ago. But she lived a very long, beautiful life. And, we thank good care for that. I want to congratulate you. You received a $1 million grant funding for community and health providers education. You're a national speaker for stroke and brain and spinal cord injury prevention. You've really dedicated your life to this, haven't you?
I really have over the last 18 years. I mean, once you get into it and you really see the difference that it is, it's a game changer. When I first started doing stroke, I also got involved in a program called Think First, which is brain and spinal cord injury prevention for children. Got heavily involved in that on a national level. And then that kind of got the speaker bug in me and started speaking for them. And then, as I got more and more involved in stroke, probably over the last 3 or 4 years, I've become an international speaker for stroke. And, it's just really been very rewarding to be able to go out there and help other stroke coordinators and people in this role be the best that they can be, not have to recreate the wheel and just really support each other. And that's just as important as the care that we're giving to our patients, because, you need people in these roles that can make programs the best they can be so the patients can get the best care that they can get.
There's no doubt about it. And highlighting stroke awareness is a really important part of what you do. I mean, you're really covering the spectrum, aren't you?
We really do try. And, excitingly enough, this was great timing with this interview, because this Friday coming up is our regional stroke symposium that Singing River Health System puts on. We started out, this will be our 13th annual symposium. I think the first one we might have had 100 people there. So we sold all 450 of our tickets in less than 4 business days. We've got people coming from 7 states. So it's become like one of the conferences to go to as healthcare providers that live in the Southeast. And so we're really proud of that. We're able to really continue to educate healthcare providers that take care of stroke survivors, in the surrounding areas, so they can give the best care possible. We're also very passionate about getting out and getting education to the community. Again, this Saturday coming up is the Jackson County Heart Walk. And so we are partnering with AHA in a sense. They'll be at our stroke symposium, and then we are having a team and promoting the Heart Walk as well at the symposium, and we'll be walking the actual event. So a lot coming up this next weekend, but really trying to support the education in our community.
Well, as you can hear, Heather Sudduth is in a long line of really dedicated people working at Singing River Health Systems that we've had the opportunity to highlight today. So, Heather, it's been great to spend some time with you.
Thank you.
This has been Singing River Health Talk. Have a great day. We'll see you tomorrow.